and thank you for joining our webinar. We really appreciate you taking the time out to meet with us today. I'm Reagan Corliss, and I am the Manager of Strategy and Brand at MedSavvy. Also, thanks for giving us a reason to dress up at least a little bit today beyond our work at home attire. We know you're dealing with a lot right now, so hopefully this is a nice break for you. MedSavvy has teamed up with Cambia's Human Performance Wellbeing Division to bring you this helpful webinar content. And we feel that now we need wellness more than ever, right? Both of our services involve wellness engagement programs, and we thought it would be interesting to share our different perspectives with you. We're really excited to present this content. And so without further ado, I will let our speakers introduce themselves to you and explain their roles.
Thanks, Reagan. My name is Emily Biscacci-Franch. I am a Client Success Manager with Cambia's Human Performance and Wellbeing Division. And I've been with the organization for about 12 years now. And in this role, I support our employer groups on anywhere from 100 up to 5,000, 10,000 employees on their employer wellness programs. So the design, implementation, and evaluation of those programs for their employees and their family members. So very excited to be here with you guys today.
Hello, everyone. My name is Kate Zitzman. I'm currently a program coordinator for the Human Performance and Wellbeing Division here at Cambia Health Solutions. I support one of our products alongside Emily here with Beyond Well, and I previously served as a health coach supporting one of our products. So I'm bringing that individual perspective to today's presentation.
Hello, everyone. I'm Janet Bronson. I'm a Client Success Manager with MedSavvy. I work with employers to encourage engagement and registration and utilization of our MedSavvy product. MedSavvy is an online resource for employers to provide to their employees to find out about low-cost medications and compare drugs side by side. I'm really excited to be here, and I'm really happy you've joined us. So we're going to go over the agenda today. So we're going to go briefly over some cost statistics. We're going to touch a lot on some trends that are happening in wellness and engagement. We're going to show you some best practices that we have, as well as some barriers that people perceive to be as a part of wellness, some case studies, and present you with some takeaways. So kind of the key perspectives that we're looking at from this presentation is a holistic approach to wellness behaviors, and that includes pharmacy management or pharmacy engagement programs, which can be impactful and effective strategy for improving health and wellness. And above those things, that data is very important in addressing population needs, and so is talking to your employees, and we'll discuss that further. So we're going to also talk about implementation of operational and culturally appropriate strategies to increase engagement for your employees. So let's touch on some cost trends. So why do we look at cost trends? Well, employee wellness programs can impact health plan costs. So we want to take a look at where we're starting from, and then we're going to look at how perhaps those can be impacted by wellness programs. Engagement in these programs is the key to success in wellness programs. So let's look at this cost trend of what's going on right now with out-of-pocket health spending for hospitals, physicians and clinics, and pharmacy. And you can see that things are projected just to continue going up and up. So we want to show you some wellness programs to see if we can bend that cost curve. So there's some wellness engagement challenge. How do you get through to your employees? So wellness programs impact on costs. We're going to talk about that. And really the challenge is designing and implementing that engagement program for all employees to get involved.
Yeah, definitely. That's a little bit where I come into play working with employers on how to engage your entire workforce. So about 26% of employers, again, are tying to at least one key business metric. And one strategy that employers are doing is providing incentives. So trying to get employees to engage in their own personal well-being through the means of incentives. So on average, about $784 per year per person is being spent on wellness. And many of you listening or watching this webinar might think that that is a lot of money to put towards wellness, and some might bat an eye and not think twice about it. because you're doing, closer to $100 per employee per month, or $1,500 per year. But again, this is where everything kind of averages out. And when we think about that upfront investment that employers are making in their well-being, kind of pales in comparison to how much employers are spending per employee per year when they are managing, whether it's a chronic condition or just managing acute care in the healthcare setting. If they're managing any condition with pharmacy, or medications and prescriptions, just the cost there, you start to think $784 is one treatment for a year for some medications. So really that upfront investment that employers are making, we really want to try to see that continue to increase over time, and most importantly, be strategic in how that is used. So top reasons for employer investment in well-being programs, there's a ton. In fact, 91% of employers are citing a reason other than just reducing employee health risk or trying to contain costs, which tends to be one of the top reasons that we hear why people will start, is that they want to contain costs. They start to see what Janet was talking a minute ago about, of just this upward trend, and they're starting to think, gosh, what do we need to do to be able to bend that cost curve? And so obviously one of the top reasons, the top three reasons, do have to do with cost and productivity, which is really interesting and valuable to see coming into the fold, because we understand, again, you can't always measure the impact that a wellness program has on claims costs, either medical or pharmacy claims costs, but you can tend to, and especially in blue collar manufacturing environments, you can tend to measure the impact that it has on productivity, on absenteeism or presenteeism, people showing up to work as expected and then working to their full capacity as expected as well. So again, over a dozen different reasons listed here. And again, 91% of employers are citing reasons other than just containing costs, which I think is always positive from the employee perspective to know, I'm not just a dollar tag that needs to be managed, but rather a person. And so we start to see that here too with this, I don't want to say a total misalignment, but a little bit. Employers in the past have been purchasing certain products or solutions for employees, of course, and their family members, but they're buying a diabetes management program. They're buying a pharmacy tool and a pharmacy management program. They're buying an EAP service. And what employees really want, well, that's great. What employees really want, they want those things, but they want to feel as though they're doing it to be able to lose weight, to sleep better, to manage their stress, to take care of their overall well-being. So what we see is employer priority to some degree is misaligned a little bit with employee health goals and what they're looking to achieve on a personal basis. And without going into all the details of the rest of this, you guys will get the slides here. You're welcome to look through this. But what this leads us to is really thinking about and challenging ourselves to rethink wellness and well-being from the point of view of the employee. I've always heard, and I feel really strongly, that you don't do anything to somebody, especially if they don't have a seat at the table. So how do we invite our employees to have a seat at the table with us as we design wellness programs, well-being programs? We talk about engagement opportunities. How do we continue to have a seat at the table for our employees? And with that, we have to listen to the voice of the employee and what they're feeling.
And that's really true, because employees, they have a couple things that they are thinking that kind of impact all of those programs that are being introduced to them. And one is the fear factor, is that they fear that they're not getting their medical care taken care of, they're not getting checkups and things done because they care about their health, but they haven't taken the time and going to get their checkups. And as you can see from these slides here, that even when they do feel ill, that they don't immediately visit a doctor or health clinic to explain their symptoms. So then that kind of leads into the second point, is that there's a time factor. A lot of employees, they feel that they don't, that they have lack of time to go get a health checkup. And part of that may be that they don't have time for work, or if they don't have time after hours, and that they feel they don't have time to be sick, and they don't have time to take off to go to a wellness appointment or a checkup appointment. So these are kind of, what employees are thinking from what's limiting them to take action. So, and it's just amazing to me to see that 55% of Americans regularly take a prescription drug, and that on average, that's 4 prescriptions, and that they're getting them from more than one provider. And this could be back to the time where they're not going to see a consistent provider each time. They're seeing one provider at one time and another provider at another time, and just treating the symptoms. So, we've got the opportunity to use pharmacy as a wellness tool too, or an absence of pharmacy as a wellness tool. So I want to point out a couple things on my next slide, because thinking about 55% of Americans regularly take a prescription drug, and here are just 12 conditions for which people can attempt lifestyle changes before taking prescription drugs, or potentially reducing prescription drug medications once they're on. And I think that is really a part of the whole wellness concept, is if we can prevent ourselves from taking prescriptions where we have lifestyle opportunities, then that will make will make our whole lives better, or it's kind of a holistic approach.
As she pointed out, quite a few conditions can be mitigated with lifestyle behaviors, but as she also pointed out, behavior change is hard. Sometimes it's easier to take a prescription pill and hope for that quick fix, but data is showing that while still, similarly to the 55% who are still taking prescription pills, 53% of US adults are meeting the aerobic physical activity guidelines. That's no coincidence, right? As a culture in the United States here, we tend to move less and eat more. But data is showing us that we're slowly but surely getting back to the basics and a little more of that holistic approach to wellness. So as you can see here, the diet quality among the youth is slowly improving. Our macronutrient profile consumption, we're slowly eating a little bit less carbs, but ultimately we're showing a little bit more of the understanding of our behaviors and that we need to get back to those basics. And that is showing, like I said, in the trends that we're seeing, in the solutions, in the different workouts that people are engaging in. Things like self-care, taking back sleep, and looking at that as a positive thing rather than being lazy and putting off work. Raising mental health awareness and making sure we focus on giving time to our emotional health and advancing that. Plant-based nutrition, gut health, all of these things are coming to the forefront and showing us that we are slowly evolving back to that holistic approach in wellness as a culture.
I took this photograph of this t-shirt because I kind of found it amusing, but it really does show what happens. We kind of start taking something and it kind of cascades, snowballs through our prescriptions that potentially you take for each of the symptoms that you may be getting from the prescriptions. And it's just kind of ties back to what Kate's saying about diet and exercise and taking care of ourselves. And it's kind of a humorous thing, but what I want to point out is that exercise, diet, and regular care lead us to that holistic approach for wellness.
Yeah, and speaking of chiming back into, from that holistic, we're obviously all singing the same tune from our different vantage points, the pharmacy engagement and how do we change lifestyle behaviors, which Kate's kind of bringing to the table in order to influence the fact that we might not need as many prescriptions as we're taking, and ideally we don't need any, and ideally, if we are taking any, we're on the right medications. But all that said, it really comes to this holistic approach to health and wellness, and that evolution to not think about health, as the World Health Organization said, not thinking about health simply as merely as the absence of disease or infirmity, but rather, complete physical, mental, social well-being. And as I go to consult with my employers, and what I urge all of you to look at is, how do we focus, while diet and exercise are critically important and the two primary pillars that we really should think about, it's a multi-billion-dollar industry, diet and exercise, and trying to get people to change their health behaviors in those two realms. But how do we really start to evolve into a more holistic view? And as employers, leveraging these 5 pillars, which it's the business group on health here that brought these up, but Gallup does it as well, World Health Organization, CDC, any organization that is providing any sort of guidance on what are the appropriate best practices for employer wellness programs, or employer well-being programs, I should say, and there is a difference. You're really focusing on these 5. You're focusing on social connectedness. Those around us influence us very strongly. So do you have a culture of well-being at your workplace? Are you supported by your spouse, significant other, or close family and friends? And so how do we drive positivity around social connectedness? Job satisfaction and career development. I know we've all been in the position where if we have goals that we're striving for within our career, we tend to show up a little bit better for that career. We start to feel a little bit better all around. What opportunities are we providing to our employees as an employer, and recognizing that career development is very much part of employer well-being programs. Third, we have financial security, and this is obviously a very hot one at all times, but it's really come into play more in the past few years as there's been more and more talk around financial wellness, and the recognition that a lack of wellness in the financial space is a huge driver of stress, poor sleep, and obviously the cascading effects from that as well, and the negative impacts if we're not taking care of ourselves financially and have the means to do so and the support. And then finally, the emotional and physical health, which they are very different. Kate talked a little bit about mental well-being. And as we talk about emotional health, that is actually becoming more and more talked about within the workplace. Historically, it's been a little bit taboo. We keep it separate. We've kind of responded to this stigma that exists in society around not talking about mental wellness, not talking about mental illness, not recognizing that we do have a responsibility to ask our peers, our coworkers, our supervisors, our subordinates, how they're doing mentally. And you're starting to see that more and more as employers are rolling out mental health first aid training at their workplace. I know a few of my clients do that. And so focusing on the emotional health and mental well-being as well. Physical health, we've already talked a little bit about diet and exercise. I know Kate will talk about this a little bit more when we hear employee voices. But when we focus on these 5 pillars, and as you go to design your wellness program, or as you start to evaluate your program, you might have other pillars that are not necessarily here. But at a minimum, these 5, and when we do that, we do tend to see across the board improved health, greater productivity, higher performance at the individual level, at the team level, division, and company level, decreased healthcare costs, and lower turnover. When an employee feels supported in these ways, they're more likely to stay with their employer. So that kind of leads us into the wellness, best practices. And these are really engagement best practices, not just for employer wellness programs, but also Janet will chime in a minute with her best practices that she's seen in consulting with employers. What we see is there's 7 key ones that, again, in my experience, and you'll see this in a lot of the literature as well, Wellness Councils of America put out something very similar. There are 7 benchmarks to success. And this very much follows that model, where starting with leadership support, right? So this is more than just a memo from the CEO stating that we have a wellness program, go do it. Leadership support means we have a wellness program. Here's why we have the program. Here's how it is connected to our company values and our mission statement as an organization, and why we take employee well-being and the well-being of our family members seriously. And then it's sustained and consistent communication over time, and showing up. So as leaders within your organization, you have to be bought in. Unfortunately, unfortunately or fortunately, you have to walk the talk. Literally, you have to walk. If you're doing a walking program, you have to walk the talk. And so leadership support is really that visible support of the program. Secondary, the C-suite, the CEO, you as maybe an HR director or VP, you can't necessarily manage the entire program. So having that supportive team or committee that is really the boots on the ground, executing on the strategy that you start to lay out there. Third point is collect and review data, qualitative and quantitative. It's easier to collect quantitative data. It's easier to do a health assessment, do biometric screening, get some hard numbers. It's a little bit harder to get qualitative feedback and hear from the voice of the employee, but it's so critically important. So commissioning employee interest surveys, doing a health culture audit, asking as an organization, how much do you feel that we have a culture of well-being here? And asking really pointed questions and then doing something with the results. And that's really where we get into the operating plan and developing meaningful goals and objectives based on the baseline data that we've collected. Develop those goals and objectives. And then we create the supportive environment, because you can have all the goals in the world to improve nutrition practices at your workplace. But if you have junk food and sugary drinks in the vending machines, you're kind of counteracting that. And so making sure that we have the supportive environment and policy to really put some power behind those goals that we've set. The next piece is in implementing holistic programs. So focusing obviously on, I give the example of nutrition, but also looking at what are we doing for mental health? Are we offering mental health first aid training? Is that something that we have the budget for? We can bring somebody in to lead that training, and implementing programs and services that really are holistic in nature. And then finally, evaluate and iterate over time. So instead of thinking about this as just being linear, it's rather kind of circular. So every year or every 6 months or every 2 years, you're kind of going back through this cycle. So we're yet again evaluating the impact that we had with the programs and policies that we put in place. And then we're iterating over time to continue to evolve and innovate with our program.
You know, Emily, these are so many of the same things that we've seen for implementing our pharmacy wellness programs. Employer support from leadership is key. It truly is. That communication channel is, and then having that direct to the employees has been, that's the way to get it across to members. And, knowing employees we want them to know what works, and that communication channel really has to be a part of it. And we know that, communication direct to the employees with that leadership support, with a teams format, those are all great perspectives, and they are best practices that we've seen also. So there's a lot of things that, there's best practices, but we know kind of what can be bent or kind of lead people in the directions for some of those, to make those decisions for change. And one of those is that I see is that if a member has skin in the game, so if, for example, if they're paying out of their own pocket, whether that's because they have a high deductible health plan with an HSA or they're paying co-insurance, they're more likely to pay attention to what the cost of something is, because they'll go in and do that extra step of research if that resource is available. With MedSavvy, they can go in and potentially shop the different pharmacies and find out what it is at each pharmacy, what the co-insurance amount would be if it's different at every pharmacy. So, all of these programs for best practices, getting those members involved really has, that common thing of, well, it's common, but it's different. It's like everything is unique for each employer because it's got to fit the company culture. So we can't just take something from this will fit your company, this will fit this company, but everything's got to be working with your company, your culture, and to make it effective. So, some of the barriers that we've seen, and I'm sure that you as an employer have also seen this, is communication roadblocks, or, that there's a lack of communication that's going to the employees. They're resistant to change, part of it's because of those fears that they have. They don't have the time, they haven't, not taken care of their medical health history, but, but they might be resistant to change. Your leadership might be resistant to change. Your team leads might be resistant to change, your management. But is this any change, whether it's wellness or pharmacy management, pharmacy engagement, it's not a one-time action. It's going to be part of change over time. One small change at a time. I think it's up to 7. I think you have to reinforce up to 7 times to make someone actually get it into their system so that they will actually take the action. So that is some of the things we want to make sure that, that are barriers, but we want to make sure we can help you overcome those.
Great, and thank you for that, Janet. Those barriers are really important to acknowledge when you're wanting to actually understand how to overcome them. And I find finding that data, and identifying those main categories is key. But if you have the opportunity, the time, which I know is limited when possible, so I can definitely pass on some of the sentiments that I've heard in my experience. But hearing the stories firsthand from people who have engaged in your programs is key, or asking the people who haven't engaged why they have not. Hearing those reasons and rationales firsthand is really important in understanding how to overcome it, how to solve that problem. And so here are some recurring themes. I've kind of boxed them together. This is traditionally all of the reasons as to what I see when people are saying, yes, this is why I'm engaging, or no, this is what's holding me back. So my sentiments as a health coach firsthand. I hear individuals who absolutely love the program. These people are advocates, they find the value in it, and they immediately want to engage. These people are really, really important for engagement because they're usually word of mouth and passion for the program is what can involve getting involved colleagues of theirs and increasing engagement that way. A lot of times, as Janet had mentioned previously, that time factor can be a big barrier. And what some people will find in diving a little bit deeper is that they find they don't have that time allotted to them at work. And that's something that goes back to the trends a little bit, is people looking for self-care and a little bit more of that work-life balance. If you're able to provide time for your employees, whether it's 5 to 10 minutes, and really encourage that culture of well-being, wellness, like Emily had alluded to, it allows them to feel like it's not homework, to feel like it's not something that you're taking home, that they have to take home and perform there. It's something that you're allowing them to do at work, and that shows that you do care about them, giving them and encouraging them to take care of their wellness and well-being there. Oftentimes I hear that individuals had no idea the service existed. That one is all too common, and usually one of the biggest barriers as to why people were late to join. The communication or message just didn't resonate with them, wasn't received, or whatever it may be, it was easily missed. That communication just didn't hit the mark, and getting that out and making sure that people are aware of the valuable programs that you have is so important in getting them to engage, because oftentimes they will. Only saving themselves money is a huge factor bringing people in. We discussed that previously. Making sure that the tool is easy to use is key. If it's hard to get into the door, people are less likely to actually walk through that front door. You want to make sure that they have ease of access, and the program that you're providing them and the solution is meeting their needs. And then finally, one that we see is receiving those communications, but like I said, they just aren't hitting the mark. The messaging is not quite what the user needs. It's not quite timely enough in where they are in their program and engagement. So making sure that you are surfacing communications and looking to engage individuals at the correct time in their program is really key as well. And all of that just to say that ultimately we want individuals to feel like these programs are bringing them value. People will put time and energy into things that they feel that they value. And for example, I mean, the average employee spends 18 minutes on average enrolling in their benefits. In contrast, the average consumer spends 4 hours on average to purchase a mobile phone. And that's no secret. It's not surprising, right? We love our phones. We find them valuable and they bring us fun. So when you do hear things like this, it's so important to ensure that the solutions and the programs that you're choosing are easy to use, understand, and engage for your population. And Emily and Janet did a great job of covering what you can do to make sure you're meeting your population needs. Taking that a step further though, getting them through the door, like I said, getting them into the program is obviously the first very most important step. And so kind of understanding 4 key themes that I've heard in market research from individuals about what brings them into the program. I've kind of boxed them down into these. And 2 of these are things that you can absolutely manage and make sure you're selecting for your population to enhance the chance of their engagement. So the first one being interesting content and a useful tool. Individuals will come through and use your program if they find it is valuable and it meets their needs. This is very important in getting that firsthand engagement, like I said. Other than that, family involvement, it's very popular for individuals to engage in a program when they've heard concerns or encouragement from a family member or a loved one. That social proof, that word of mouth, obviously is very important driving factor in motivating us to change our behaviors. So that can definitely be a jump start, a common jump point for most individuals. Personal event or situation, a health scare, no surprise to anybody, can actually wake us up and encourage us to and change our behavior. So that's one that we hear oftentimes as to why somebody first joined a program. And then finally, easy first steps. You want to make sure that you're giving somebody easy wins. Like we said, changing behavior is hard. It requires our energy, our time. It can feel uncomfortable. And we want to make sure that those first changes are easy. They build the user's confidence and encourage them to come back and continue to engage with the program. And speaking of continuing to engage, getting them through the door and that firsthand engagement is important, but we want to be sure that we're encouraging retention. We want people to continue to use the programs and solution, making sure that it's supporting their lifestyle and helping them maintain their choices. And so these are the things that I've heard in my market research firsthand from individuals that really kept them coming back, that made them feel supported, made their journey feel easy, made the program feel successful to them. So the first one being human support. It's no surprise. It makes it feel so much more personable when we're able to very easily chat with someone and interact with somebody and get help if we need to. So individuals will often say, yes, encouragement and accountability from a coach, a community, being able to interact with my colleagues or a care guide was huge for me. Making sure that the program or solution grows and expands as they are learning new things and changing their behaviors is important. If something stays stagnant, it usually cannot fit that individual's lifestyle. We want to make sure it's constantly changing with them. And with that, new things to discover and try. If you're showing the individual the same kind of engaging information, content, they're not going to continue to come back. So making sure you're providing them new and engaging stuff is so important. Bringing joy into the task. This is one that I feel we often forget about, we often lose sight of. Pharmacy wellness and wellness, as long as you're making sure that you are bringing joy and weaving that creativity in, making sure that engaging with the program doesn't feel like work to the individual is so important. You want to make sure that this program feels as if it's provided to support them. And two, if it can connect with an interest, a passion of theirs, all the better. And then finally, seeing success. Everybody wants to see that their efforts are paying off. So ensuring that you're enrolling in a program or you're setting your employees up in a program that can show them the value of their engagement, that can show them by putting that time in that they're actually getting something back, that their health is improving, that all of that is improving for them is so important. So making sure the program has engaging and timely reporting is key as well, and that encouraged retention.
So Kate just touched on quite a bit of that individual perspective. We've shared, Jen and I have both shared some best practices in how employers can be successful in implementing well-being solutions. And so we just want to highlight a few case studies. So a few examples of where employers have successfully done what we've talked about. So while we try to bring forth best practices, we also learn from our employers, and we always want to be able to share out successful. So the first employer that I want to talk about here, they're a little bit, relatively speaking, on the smaller side in the grand scheme. There are about 450 or so employees are in the financial services industry. And this particular employer, they're highly, maybe 90% or so female. And so it's, being sensitive to and recognizing that we all have different needs. What speaks to predominantly female population is very different than what speaks to a male population. And so for this particular employer, they really wanted to focus on supporting and engaging their workforce with well-being activities and incentives that mattered to, again, mostly women. And so they're actually rolling out on our new Beyond Well platform. We've worked with them for the past 5 years or so on our legacy platform before that. And so through the platform, they offer well-being activities that are eligible for points that can be redeemed for gift cards, Amazon gift cards, and they do up to $300 per employee per year, strictly in gift cards, and they have other incentives as well. Part of trying to hear that voice of the employee, and specifically in this case, the female population, they commissioned an employee-wide interest survey, trying to gather feedback from employees on what they care about, not wanting to make too many assumptions there. But again, asking pointed questions around what type of programming they care about. Of course, with it being more of a female population, there was a heavy focus on nutrition and healthy cooking demos. And this is a very dispersed population, but looking to do some webcams and screen sharing like this with healthy cooking demos and talking about healthy recipes to make at home. And so we're really excited this year as we go to roll out some new programs and activities as a result of that feedback that we heard from them. With that, what you're seeing on the left side here is kind of a word bubble when we ask freehand a question around what they thought about wellness at this particular employer. What did they say? And what you see here is this group in particular, they do quarterly challenges. You see challenges pop up. You see time and work pop up, which are two that Janet was talking about earlier around the time factor, not feeling like you have time to participate, whether that's because you're at work, and desire for work-life balance, and being supported in that way. You also see some words in there like great, and like, which could be either a filler or they like the program. You see things like health, and so we're really, this is something, again, we rolled out with them last year, just doing this employee interest survey. We're excited as we go into this new year, as we've already gone into this new year, to see how it all plays out. But historically speaking, over the last few years here with them, we've had some really successful results. So over 50% of their population completes the health assessment every year, which, it can vary within any given year, but to be able to see that repeat completion really allows us to identify how are we trending over time with individuals' health behaviors. We're obviously asking questions about that on the health assessment, and then actual results. So capturing some biometric data, are people going in for their annual preventive exam, their dental exam, flu shot, et cetera. And so seeing that great participation year over year and consistent there. In addition, we're seeing 40 to 60% of employees are participating in any one of the given quarterly challenges. And then overall participation from 2018 to 2019, so where we finished this 2019 year, we saw increases across the board. So 65% increase from the previous year in employees tracking strength workouts, which we know and Kate's could very well speak to as well, around the power of tracking your health behaviors to actually influence behavior change and health outcomes. And so folks actually tracking their strength workouts, completing an online educational program, so increasing their health literacy, and then an increase also in those who are reading the Wellness Monthly blog and then completing a short quiz to test their knowledge on what they learned. So every month doing that, and we saw an increase in how many folks are participating in that. The second case study we have here is on the opposite side of the spectrum. So about 1,200 or so employees, but opposite in that it's blue collar work. They're in the lumber industry, and they're predominantly male. So very much the flip side here, where, we're seeing, shift work, guys that are on the line, they're not sitting at a desk. They're not necessarily what we look at the females being the healthcare CEO of their family. They're kind of the opposite. So it's a little bit of a harder to reach population, a little bit harder to motivate them to take action unless their spouse is kicking them at home to do something. And so we really had two goals or two challenges opportunities with this particular employer. One of them was try to inspire and motivate them. And then the second was to streamline the administration of the program for HR. These are guys that would just come into the HR office, say, I did my annual wellness exam, give me credit for it, and slap a doctor's note down on the desk of the HR professional. And we wanted to really streamline the administration of the program to free up the HR team's time to not do that, also respect privacy between the employer and employee, and then also allow individuals, the actual employees, to engage real time in ways that are meaningful to them, and using an app to be able to track their participation. And so what we did here was that we, understood the company culture. We posted inspirational flyers throughout the worksite, posted, the IFG for life, warning signs for sitting. So trying to recognize that sitting for prolonged periods of time isn't great for your health. That was all in the administrative offices. And then again, we moved online and had a robust mobile app to try to engage folks. So what we saw here is with over 8 years of participation and partnership, we went from 10% engagement to 60% and climbing as the program continues to evolve.
What's incredible is this case study here is the exact same company that Emily was just talking about, that MedSavvy has just started working with, and their goal was really to see what they could do about lowering prescription costs and educating their members about those costs. So we did multiple communication methods to the members, and one of those things that the employer did, which I thought was really good because they have multiple locations in a lot of rural settings, is that they made sure that each of their locations had Wi-Fi on site, because not all of it did, so that was not a barrier to access to using the app, using the program, MedSavvy, on their phone, so they could actually use it. If they have a question, they could do it now instead of putting it aside and asking and forgetting about asking it later. I think they really did learn from working with Emily's team, because there's mandatory meetings for the employees to show up, so that they would be educated and they would know about this information, so the new product that was available. And we also had some really big incentives. That was a big incentive that was targeted toward the male population. They offered a trigger grill to these employees. And it was kind of funny, but it really did work in getting engagement. That was another tool. So it's like we removed a lot of those barriers with the employer, and getting that Wi-Fi access, getting it so the employee could actually access the product at any time while they're at work, and then having those face-to-face, so that communication barrier is removed. They were able to hear about it themselves and not secondhand, so that they all got the information first time about a new program that's being provided to them. The train the trainer was another thing. So they do have multiple locations. So they made sure that their HR team, had the same consistent message from the leadership down to each of the face-to-face, managers and the face-to-face HR people out at each of the locations. And that was definitely driven by the company leadership and supported by them. We did the similar information, or posting posters out on site. We had the benefits platform, the intranet. We also provided information. We did the home mailings. We did email invitations to those that did have their work emails. And so we had a lot of materials out there reminding them about a new product being available for them to take advantage of. So really what we saw was 45% registration in our product within 12 months. Another employer that we have worked with, this was a employer that's primarily education. There are about 3,600 lives. They're all ages and gender. They wanted to make sure that their employees were aware of costs, and pharmacy costs in particular. So again, we did the multiple methods of communication to the home, to the work email addresses, posting on the intranet, their benefit site. And then this was something we were able to do too, is tie the registration on the MedSavvy to an individual incentive. So that if they were entered to win for something, a gift card. And what it also did was, if they did register, there was another way that we tied it so that if they, the employer tied this program in, so if people engaged, registered, they confirmed that they registered, then they were put, that was applied to their wellness points that they were accruing. And that was great because after this employer, if you got a certain number of wellness points you had, and that was an impact on your portion of your premium that you're paying out of your pocket. So that, I think, was taking that, showing the employees that, okay, we can, maybe you're not going to use this product today, but this is how it's going to save you some money now if you get ready to have it available when you do need it. So huge support here from the organization. Having a wellness champion at each location was huge. And again, those communications are multiple communication formats. So with that, we had 41% registration in less than 6 months. And this little poster down on the left is a mirror cling that's put into education sources, where a mirror or a window that they would be seeing as employees. And I have one more case study I want to touch on. And this one is a relative, it's a little bit different software employer. They'd rolled out a high deductible health plan to their employees. They wanted their employees to be educated, to be aware of how potentially they could save or be aware of costs through and save themselves money on their high deductible health plan, keeping that HSA money for themselves for when they needed it in the future. Again, multiple communication methods, those posters, emails, home addresses, the flyers. We even did targeted mailings to this for individuals with an opportunity to save on specific medications. And what I really liked on this one was unique is that this was a theme that they had, was that everything was Star Wars related for their open enrollment and benefit fair. So we made sure that all of our things were Star Wars related, kind of got their attention that way, and kind of tied into the culture of the employees, a younger age, software, high tech, maybe more interest in Star Wars than some of our other customers would be. And again, management and HR, they're definitely leading by example. This is where they have the wellness on site with the healthy food location, healthy food options. They have an on-site fitness center. They're in a metropolitan area, so they encourage bike commuting and a safe place to store those bikes, and a repair station. So those are all very important if you want to continue using your bike every day. So these are, that really shows the things that this employer has done, that tying it in for the wellness, and what it's done is over the past, in 2 years, we had 50% registration. So it just continues to grow when that communication is down and it tied into the other areas where it's, the wellness and getting that engagement. So I think this is really great. It shows about our case studies, but what I really want to do is kind of leave you with a few takeaways from all of us. And from the MedSavvy perspective, these are just some of the materials that we use and some of the techniques that we use to kind of get those communication out. And it's like Kate had said, easy to understand tools, direct mail, communication to the members. We've got more materials to put out, locations, picture-based. It makes it easy to see, oh, a picture caught my eye rather than a whole bunch of words. We've done raffles, incentives, gamification. We really want to, lots of different things I'm sure that you've seen, webinars, lunch and learns, and partnering with other benefit products, like partnering with our wellness options that the employer has purchased and put together. And we definitely want to do that. Whatever we can do to get that synergy for people to engage in wellness. Some other things that we've been doing is kind of looking at some new approaches that we're working on now. And these are some condition-specific, employer-specific, targeted and focused engagement campaigns. So these are going to be working with the employer when we've got that engagement, we've got the registration. This is moving to that next step where we can look at a specific condition and see what's going to be effective to get the next step for engagement for that employer. Right. So all of this for MedSavvy is showing that we're getting more people to register and sign up. our registration rate being about 30% compared to the so an average of about 10%. We're getting more people to engage in registering once that they have registered, that they're taking actions, they're looking at the medications that are on the system, they're using it for all of their, for when they need it or the family needs it. So we're getting some results on that. So in conclusion, these are the key takeaways that we kind of talked about these at the very beginning, our messages that we wanted you to know about. And it's a holistic approach to wellness behaviors, including pharmacy engagement programs. That can be impactful and effective strategy for improving the health and wellness of your employees. Diet and exercise are the A+ grades for doing this, but there's a whole lot of other services that are available and products that can be offered to your employees to improve health and wellness.
Mm-hmm. And as we mentioned, data and making sure you understand what your employees want to save money, to get healthier is really important in addressing your population needs. But so is taking it that step further and really understanding their stories, talking to your employees. As Emily mentioned, asking creatively for feedback, listening, relying on partners to do that. Engagement solutions aren't one size fits all. So making sure you understand the context of your population, your culture is really important in addressing those needs thoroughly.
Yeah, just on that point, this last piece here on implementing appropriate strategies. So it's not one size fits all, even though we've shared, and I hear this all the time. Well, what are others doing? What are other employers like us, or where we want to go, so tell us how to get there. And I wish that we could just, pick up and drop somewhere else, but it really has to be culturally appropriate. So the Star Wars theme that Janet was talking about might not work for another employer. It probably doesn't work for a lot of employers. So certain strategies on not just what are you implementing, but how and why you're implementing that and communicating it. It's got to be appropriate and relevant for the population. And that truly will increase and sustain engagement over time. And one key strategy to do that is to keep communications consistent. I have a tendency, when we first working, and I know MedSavvy goes through this too, when we first start working with an employer, we come up with a great first quarter. They're all on board to communicate. And then it's, the second quarter after that, okay, where's our communication? We've developed this plan. And the ones that do it well are the ones that have thought out for the entire year or 2 years. They have an idea of where they're going, and they have an idea and an understanding of how they can leverage communications and marketing so that it stays present with employees on an ongoing basis. And so really being consistent with those marketing communication efforts. So just as we come to wrap up here, a little bit about us. Again, I think you've learned a little bit, and that obviously we all support employers and employees in various ways. Kate and myself, we represent the Human Performance and Wellbeing Division here at Cambia Health Solutions. And with that, we're headquartered here in Portland, Oregon, but we support employers throughout the United States. We have 2 different solutions that we lean on to be able to do that. One of them is Regents Empower, which is tied to the Regents Health Plan in Washington, Oregon, Idaho, and Utah. And then the other is our non-health plan affiliate, and that is Beyond Well. And with both solutions, we support employers with a platform that has a health assessment and those online education tools, the ability to track wellness points. So a lot of times when a group also has MedSavvy, that's part of the well-being activities to accumulate points towards some type of incentive. And so our platform, products and services, and Kate, myself being part of the service arm here, we support over 1 million lives today across the entire United States.
Thank you, Emily. And more about MedSavvy. We are unique and innovative employee benefit. We integrate with your existing benefit plan, with your pharmacy benefit plan. We provide employees with online access to medication costs, quality and side effects, and side-by-side comparisons of their medications. And those side-by-side comparisons are graded by our pharmacists, our licensed clinical pharmacists, review scientific data, look at the information that is provided based on studies on each medication, and assign that medication a drug a letter grade, whether it's an A, B, C, or an F. And then that makes it easier for you as a member, as an employee, to side-by-side comparison. You see the cost, not only the cost, but you see the effectiveness of that drug for your medical condition. So we want to help employers and employees save medication costs, but it also improve their health, productivity, and reducing absenteeism as a part of that benefit. And our team of online pharmacists provide consultations. You can ask them questions. You can ask for reviews of all the medications that you're currently taking. You can ask our pharmacist and questions about any medications in your medicine cabinet, and we can provide a 2-day turnaround time, a 2 business day turnaround time on those questions. So, and again, those plans are based on, the costs are based on your plan, health plan, and your location. Our next steps, and if you want additional information about MedSavvy, a demonstration about MedSavvy, additional information about Beyond Well or a demonstration, please go ahead and let us know. Any of your feedback is welcome. And again, thank you so much for attending today. Here's our contact information for MedSavvy and for Cambia Human Performance and Wellbeing, Kate and Emily.